packaging that has a round stamp with the letter F because F is for
Fortified.
The absence of major micronutrients like vitamin A, iron, zinc, and B vitamins, especially in women and children, is high in East and Central Africa.
We have a lot of food deficiency or nutritional deficiency related diseases, and this is mainly in the area of micronutrients.
The USAID A to Z Micronutrient and Child Blindness Project goal is to increase the use of key interventions to improve child and maternal health. One intervention has been the fortification of oil with vitamin A. Other interventions are needed, however, to improve the overall quality of the diet found in many Ugandan households.
People are eating chapatis which have been made from cooking oil. They're eating maybe the mandazis, those small kiosks, restaurants. They will sell products which have been made using cooking oil. So by fortifying the food, we are trying to fill in that gap of what is missing in our daily diet, and which we will not get it unless we eat that fortified food.
Well, my memory goes back as far back as 2000, when USAID came along to support Uganda for the micronutrient program. And among the processes that had to be put in place was the National Fortification Alliance.
The National Food Fortification Working Group is a membership mandated through the Ministry of Health, consisting private sector, basically the industries which are fortifying, civil society organizations, the consumers' representatives, and also the technical people from academia, basically the Food Science and Technology, Makerere University.
We feel this will help and improve the people's health, and at the same time it is also improving the economic status of the people who are producing this oil.
Now in the area of fortification, the issue is we would like to fortify. That's we want to add the nutrients to the food. So then the issue of standards comes in. How do we fortify actually? What do we add? And at the marketplace, of course, then from the consumer point of view, he needs some of this information to be available for the consumer to make the choice.
We don't have any manufacturing facility for the fortificants which are used within Uganda. So all of them are imported from outside the country. So we ensure safety and quality of the imported products.
Once you accept to carry out this responsibility, then you have to engage in the right and acceptable manufacturing practices, the hygiene, the exact measurements and the discipline that goes into keeping the fortificant in the best acceptable condition and handling it in a way that will contribute to the final desired objective.
Uganda is making a difference. Fortifying oil with vitamin A is a public health intervention meant to improve cognitive development, educational performance, and long-term productivity.
We have got evidence documented that the national coverage from the first industry and then thereafter followed by the second industry has gone up to the coverage of 85 to 90%. Fortification became a competitive advantage in the market. It improved what you would call brand value for the fortified oil, and therefore any player on the market that did not fortify found themselves competing from the low end.
USAID, through its MOST and A to Z projects, has been a partner with Uganda in this historic achievement. Other partners such as GAIN, the World Food Programme, and UNICEF have made their contributions as well. Together they have strengthened operational systems, leveraged local solutions, integrated the delivery of micronutrients into other health services, and created access to knowledge sharing and collaboration around complex and critical regional challenges.
Industries that produce unfortified oil are able to market it in Uganda, and yet that is a big challenge because our oil is already fortified, and the imported oil is of low price.
When we started Fortification here, it's like it wasn't going on in other places. So the experience from Uganda has been used to reflect also in those other countries that if we in Uganda we can fortify vegetable oil, then it should be possible at the regional level.
There has been a need to sensitize some people. Particularly, it's not the rural people, it is the urban people who sometimes feel that adding anything to food somehow makes it worse.
This is actually a very serious problem. People are dying because of lack of vitamin A, and it is not very complicated. It's not rocket science that vitamin A could be taken to the populations through the foods that they eat.
This consumption of fortified foods raises hope that eventually we'll be there. And there's a shift now towards more self-reliance among Ugandans, which is a very good thing.
This is a much simpler way of managing malnutrition than admitting somebody to a hospital or putting somebody on a special diet or administering pills.
To have a sustainable program, the nationals must take ownership and must drive the program. And that's what we are doing here. Of course, we welcome assistance from outside, but it's our program.
And we must remember fortification is a new strategy in Africa. It's not easy, but to keep the industries committed, I think the National Fortification Alliance has played a role to support that process.